Hello and welcome to one and all. So, students, welcome back to my social science class. So, today we are dealing with a very different topic, and this chapter is for class 7th and 6th as well. So, today we are going to deal with something which is very exciting, something which is very important for all of us to know that what our government as a country of India is doing for its citizens. So before wasting further time, come let's study our main topic for today. So yes, today we are going to deal with role of government in health. So as we can see that I have pasted one map of India over here. So anybody has got any idea that which state or which city in India is having the best medical system, facilities, insurance facilities, hospital facilities? If you have any idea, you may comment down in the chat box and let's move forward. So, before we proceed further, students, I have pasted some images for you and you need to observe these images carefully and you need to tell me what will happen if we will have image 1 and 2. So the foods which is there in image 1 and 2, what in fact impact and effect will these food have on your body? And if you are going to consume food number 3 and food number 4, so consequently what impact does these foods will have on your body? You need to tell me. From my perspective, the images that are there on first and second, these are unhealthy food. Why? Because these are labeled as junk foods. Junk items are very easy to make. They are made in an instant, but yes, they have a lot of detrimental effects and bad and negative effects on our health and body. They also reduce our immune system and they lessen our immunization power to fight with the diseases. Whereas on the other hand, the picture, the food items which is there visible on the image number 3 and image number 4, as we can see they have lot of fruits, green vegetables, broccoli, cherry tomatoes, we have I can see avocado, I can see nuts, fish, pomegranate, onions, mustard, and lots of rainbow colors in the image number 3 and 4. So we have heard from our parents, from our grandparents, that consuming these foods is very essential for our health and well-being and total body. So this is the difference between healthy foods and junk foods. So let's observe what is health. If we are having good health, how can we have good health? Only by consuming healthy foods? I don't think so. You may tell me. I need all these answers from all of you, that what is health and how we can achieve a healthy body. So in the image we can see an elderly couple who is having the usual morning walk or let's say evening walk. So according to WHO, now World Health Organization is an organization that takes care of all the diseases, medical facilities and all those things of the entire world. That's why it is named as Organization of World Health. Health, now they are defining health according to their own terms, right? So health is a complete state of physical, our external body, mental, our mind, social well-being, the people whom we sit with, have communicate with, have conversation with, and not merely the absence of disease. We should have a complete physical, mental and social good health. It is not health. Okay, if I say I am healthy, I don't have any disease, will it be health? What if I am only disease free but I am not happy from within? So will I be considered healthy? No. Yes. So not only we need to be happy, a good body, good physique, and we should have good friends. We should have, a compilation or combination of all these things. Whereas on the other hand, we should eradicate diseases. So definitely health can be maintained by having a balanced diet, which we saw in the previous video, previous images. Clean food, definitely clean water, because water is very detrimental. If you're not having access to good and healthy water, clean water, we can have n number of diseases like cholera, jaundice, typhoid, and bad stomach. We should also have personal hygiene, and we should also practice exercise and take proper rest. So now if I'll ask you, how can a person be healthy or unhealthy, you need to tell me how will he be healthy, which we just discussed, and how can he be unhealthy, which we also discussed. So you need to have a proper point of differentiation between healthy and unhealthy. So before wasting more time, now we have World Health Organization, that is WHO. Now what is WHO all about? It is an international body. So when I say international body, you need to quickly think that it works globally. It takes care of all those states and countries around the world, which is responsible for public health. Now, WHO is a part of United Nations and it was established in 1948. So it is involved in the aspects of health, health policy, planning, good health, healthy lifestyle. Students, 2 years before pandemic hit the entire world. So it was this WHO who gave the all those necessary and essential guidelines, how to take care of yourself during this pandemic stress, how to sanitize, how to have a healthy and balanced diet. So it was this organization that took the initiative and kept on posting regularly on their websites how to take care of our health. So yes, this works globally. Now, tell me, who will take care of these sick people and ill people when they are ill? Okay, you might say this person is ill, he is having some sort of headache, so he is having a cup of tea or coffee. Now he is also sick and he is having medicines which are kept beside his bed. So now who will take care? Parents will take care, definitely, but how? They can only take him to doctor, to hospitals, to nursing homes, to homeopathic doctors, to okay. So what else? Just think. If we combine those doctors, those hospitals, those medical centers, those nursing facilities, so collaboratively, कौन देखेगा? Who it is the whose role it is? I think it's the role of the government in healthcare, because government is only providing us these facilities, no? Providing doctors, establishing hospitals. So I think government plays a very huge role in healthcare. Let's see how. Now I have pasted few images over here which states about India. Okay, on the one hand, on the left hand side, we can see that how India is having the largest number of medical colleges in the world. Yes, we have AIMS, we have CMC, Vellore, and all those various medical colleges in the world, and it is largest producer of doctors also. So yes, we need to keep this fact in mind. Now, healthcare facilities have grown substantially over the years. Initially, it was less, like we had only 2717 government hospitals in 1950. When we come to 1991, we have 11,000. The rate has almost folded 10 times. And when we consider in 2017, the rate grew to 23,583, almost more than the double. So here we can see how healthcare facilities are emerging as one of the most important occupations. But India gets a large number of medical tourists from many other countries. Let's say from nearby Asian countries as Bangladesh, Bhutan, Nepal, Indonesia, Thailand, Malaysia, all those nearest countries, the tourists come to India to get themselves treated and checked. So they come in some form of hospitals and they think that India is the best in the world in the place of health and facilities. And apart from that, India is the third largest producer of medicines in the world. It not only it exports medicines, it also produces it. produces it in the large quantities. So this was the positive side of Indian healthcare system, basically government healthcare system. Now let's compare the other part of the slide, which is there on the right hand side of the screen. Most doctors settle in urban areas. So the first point is doctors are settling in urban areas. So what about rural areas? So now it is said that people in rural areas have to travel long distances to reach a doctor. And this is one of the most common thing why rural care is not having rural health areas are not having a better healthcare facility, and as a result of this impact, many people in rural areas such as villages and minor cities are dying of simple and silly diseases, right? So number of doctors with respect to population is very less in rural areas because first of all it is not at all developed. So no one will go there and treat the patients. So in order to make it more developed, firstly we need to think how we can expand the areas nearby. About 5 lakh people die from TB every year. TB is one type of disease which is associated with our lungs. See, the number is 5 lakh people. This is almost unchanged since independence. Almost 2 million cases of malaria are reported every year and they are not at all decreasing, rather increasing. So we are not able to provide clean drinking water to all. One hand we can see it is the largest number of medical tourists are coming, and other hand we are saying that we are not able to provide good drinking water. It is also a form of communicable diseases such as diarrhea, worms and jaundice, cholera, typhoid and what else. So half of the children, they do not get adequate food to eat, and that is why they are undernourished. So see, can we compare the things, the statements on the left hand side with the statements on the right hand side? So this is the actual scenario of Indian care in respect to healthcare facilities. Now if a question comes to our mind, students, ki okay, though India is a developing country, the healthcare facilities might not be good. So what else can we do from ourselves to provide better healthcare facilities? I need some points from all of you. You need to write all those points in the chat box. So first of all, how we can help? In order to prevent disease and illness, we need appropriate healthcare facilities such as we need hospitals, we need laboratories for testing our blood test, urine sample and what else. We need quick ambulance services. We need blood banks who can give us blood at a minimum duration, right? So these can be provided at optimum cost, which will definitely improve the system of healthcare industries in our country. Now, in order to run such facilities, we don't need only these things. Apart from these things, we require healthcare frontline workers, nurses and qualified doctors and other professionals such as, people who are there in laboratories, who take your blood test, who take your urine test for sample, who diagnose what type of problem you are having, who tell us what is the perfect from a X-ray or radioactologist, like all those people we need. When we are having such type of people which are professional in nature, having good education and good basic idea, so definitely we'll have a better healthcare facilities. There is no second thought about it, right? So we also need medicines and equipment such as various testing machines that are necessary for patients. So having these things will definitely increase the potential aspects of healthcare. Now, India has a large number of doctors and clinics and hospitals. So, the country is also having considerable experience and knowledge in running a public healthcare system. So, what happens when I speak of the word public healthcare system? Now, in the previous chapters, we might have discussed a number of times that whenever the word public comes, we need to quickly think in mind that it is related to government. So, this is a system of hospitals and healthcare centers which is run solely by the government. There is no sort of private partnership in it. It has the ability to look after the health and section of large number of people and its population which is scattered over thousands and thousands of villages. Right? We also need to look more deep and think of various possible factors with which how we can enhance our healthcare industry. So these are few basic points. Now there is a time for all of you. Now there is a testing time. Now I have pasted two images on the screen. You need to elaborate and tell me by writing in the chat box or by writing on your notebooks that what will happen if we consume the food items in both the images. How will it have a good impact on our body? How will it have a negative impact on our body? And what food items we need to consume today and in future to ensure a healthy and balanced living life? So you need to tell this in the chat box elaboratively. Okay, no one but answers. So there's a question for you now. WHO means World Health Organization. Is this statement true or false? Second is, we all are responsible for our health. Yes, definitely yes. So this is yes, and give examples. Whatever we are eating, drinking, thinking, that all impacts our health. So ultimately we are responsible for our health, students. Now observe these two images carefully. Think what these images are, what is the background of these images, where do we often find such type of settings, in which sectors, in private or in public. I'll give you time of 30 seconds to think. Keep each and every detail in mind while thinking. Okay, so yes, the time is up now. I think the first image is of a good hospital. It looks like good hospital, good lighting, more number of qualified nurses. The background is good. It looks like it's private sector because they take huge amount of money from the citizens and provide facilities at a higher rate. And I think the second image is also of a public sector or private sector. Private sector. So these two images are interlinked. Now think this image belongs to public sector, and we can easily tell the difference between the images which are there on the top and images which are there on the down. And this is definitely again an example of public sector. So how can we compare and contrast, students? See, on the first and second image, we can see proper lighting, good testing machinery, we have systems, we have qualified doctors and nurses. There's one single patient who's lying on the bed, and there are 1, 2, 3 and 4 nurses are attending that one single patient. We can see how proper and neat and clean the background looks. So I don't think that this can be the situation of a government hospital. Can we? Yes or no? Definitely not. Again, that same rule applies in the second image. But when we come down and look in the public images, we can see how people are standing in long queue and waiting, and there is only one nurse or doctor to treat the patient. Again, we can see that this is the condition of public healthcare systems, public hospitals that are run by the government, and these are run by private. Now when we say private, we should immediately think that individuals, businessmen, people who are having more money, they are running, and there is no interference of government in private sector. Now public, as I also informed you beforehand also, students, public means government. So public healthcare system or is a chain of healthcare centers and hospitals that is run by the government in the entire India. Now they are linked together so that they can cover both rural and urban areas, and they can also provide treatment to all sorts of problems, from the common illness such as headache, fever, dengue, flu, to special services such as surgeries in various matters. At the village level, there are health centers where there is usually a nurse, which we saw in the previous image, and a village healthcare worker. They are trained, definitely they are trained in dealing with common illness, and they work under supervision of doctors at the primary health center. So such center covers many districts in rural area. At districts is the district hospital that supervises all those districts, and then we have one single government hospitals that takes care of all the district hospitals. So I hope this concept of public healthcare services, how it is divided into villages, I write it over here, how it is divided into villages, then it comes to districts, and then it is having one main government hospital. So this is the division of public healthcare system. Now, health service is called public for many reasons. First of all, it to provide its commitment of provided healthcare citizens to all. It has to keep the cost of its services very less or minimum. The government has established these hospitals and healthcare centers. So wherever public will come, we need to immediately think that it is related to government. Government is the sole owner and controller of these systems. Now, there are also required resources. Now you must be thinking, teacher, how is it possible that government is functioning all these hospitals and it is taking such less amount of money from people? So government को loss नहीं होता है. Naturally, this idea will come in our mind, no students. So definitely we need to think that how these resources are run. Oh, so where does that money come from? That money comes from the tax and the healthcare tax that is taken by the government of India. So one of the most important aspects of public healthcare system is that it is meant to provide quality healthcare services. It also provides free. Yes, you have heard it correctly. It is also free or at a low cost so that even poor people can also afford, or else even if we will keep the prices very high above the minimum rate, how will people, poor people, those who are daily wage laborers, how will they survive? How will they get themselves treated? So we need to keep in mind always the low cost is the benefit so that even poor people can seek treatment. Another important function of public healthcare is the action to prevent spread of various diseases that is basically spread in poor people such as tuberculosis, malaria, jaundice by drinking of contaminated water, and cholera that is also equivalent to drinking of contaminated water. Now, so far we have discussed about public healthcare systems that are run by government in village, district and town level. Now we will discuss about private. Private means individuals. There is no interference of government in it. No government, okay? Government is not dealing in it. Now, whenever we think of the word private, what immediately comes to our mind? Oh, there are good nurses, there are good doctors, clean and spacious, good large air-conditioned cabins, better healthcare facilities. But with all those services, what comes? Higher prices of all those facilities. So let's discuss something about which we know as private. Now, before we talk, there's one small task for all of you. Today, after you listen to this entire lesson, you need to ask your parents whenever anybody in the family falls sick, where do you generally go and take help? Do you go and visit the public healthcare systems and the private? If public, then why? And if private, then why? And you need to write all those answers and comment in the chat box so that you will be able to know the concept better. Now, there are wide range of private healthcare facilities that are there in a country, no doubt. A large number of doctors also run their own private clinics. There is no interference of government in it. Doctor can run their private clinics even at their home or anywhere else by purchasing a clinic. In rural areas, one finds registered medical practitioners. Urban areas has large number of doctors. If you are having stomach pain, you can go to 10 doctors, 20 doctors, 30 doctors. So this is a difference between urban areas and rural areas. In rural areas, you have to find one registered medical practitioner who is a doctor who practices. But on the other hand, you can find doctors in urban areas easily. There are plenty of doctors. Nursing homes, laboratories, and other services and facilities such as X-ray, ultrasound, MRI. Then we have shops where we can purchase good medicines that are prescribed by the doctor. But इसका benefit क्या है ये तो हमें पता चल गया है. Good treatment, everything is nice. We can see in this image also how everything is neat and clean. But it has some sort of side effects. Is it adequate to all? Is my question to all of you. Think first. Hey, private is good. It looks so good. But does healthcare and private facilities provide equality? Does it provide equality in any sense? Is it adequate to all? That means can people from all caste, race, minorities, can they afford private facilities? No. The answer is no. Why? Because private people are increasing their clinics, everything, their prices, but public government sector is not increasing. जितने हॉस्पिटल्स थे उससे 2000 ज़्यादा ही बड़े होंगे, but not with a good margin. Private doctors are charging a lot of money. They should use and prescribe generic medicines, but what are they doing? They are prescribing us branded medicines. Now what is branded medicine? Same medicine आपको मिलेगा 10 rupees or 20 rupees or 30 rupees, that is generic medicines. But when they provide branded, same medicine for same problem, for fever, everything, the cost will be 200, even 300, right? So this is the situation. Now inexpensive alternatives should be given, but private medical practitioners, they don't give us, they always suggest us what is expensive. Okay, so now they are charging unnecessary money. Okay, आपको पेट में दर्द है, आप अल्ट्रासाउंड करा लीजिए, एक्सरे करवा लीजिए, do this, do that, do this, do that, and they make such a lump sum amount of bill. So this should be avoided if people want proper equity of healthcare facilities. Now, branded medicine should not be given to poor people. Neither should they be prescribed. They should only be given generic medicines that are available at a lower cost. And due to healthcare, there is disparity between rich people and poor people because of expensiveness and affordability. Rich people तो चले जाएंगे. Rich people can go to the private people. But what about poor people? Can they afford? No. So due to this healthcare, due to this difference between these two sectors, they need to provide different set of things. Now, I have pasted one interesting news for all of you. Now, before we proceed to this news, you need to think and tell me what differences do you find when there is private and when there is public health services in your area. Think of your particular area. Make a list. You need to make such type of list and write public, PUBLIK, and write private. Think, discuss it with your parents. What are the differences? What are the similarities? And present it in the chat box, right? Now I have pasted one image. This is a graph. This is a trend of news. This shows public versus private healthcare. Now, private healthcare in India costs about 4 times. Suppose if you are spending 10,000 in public, you need to spend more than 40,000 in private healthcare sector. And yet all cases are treated by the private sector. So we can see there is a difference. There is a difference in the amount, difference in the treatment in the rural areas, urban areas, and how this leads to inequality. Definitely this leads to inequality, students, definitely. Before we proceed further, there is a quick check test time for all of you. The healthcare facilities are provided into dash types. Two types we have just studied. What are those? One is public and other one is private. Dash are controlled by the government. It's public. Public are controlled and operated only by the government. There is no sort of interference regard to private. Now, before we proceed further, I have pasted few images which is there on the screen. This is definitely of our country, India. Think about what are we discussing today. You will think, ma'am, हम तो healthcare पढ़ रहे थे. We were studying about hospitals, about public, about private. From where do we need to know about these beaches, right? So what are these? These are beaches. So where do you find such type of coconut trees, houseboats in India? It's not Goa. Definitely it's not Goa. Think southern part of India. So today we will be dealing about Kerala. Yes. Kerala is known as God's own country and it is very, very beautiful. And Kerala is also known for its highest literacy rate. But apart from all these things, Kerala is also famous for one thing. पता है क्या है? Healthcare. Now we discussed about literacy. It is the highest state of literacy rate in India and it is also very famous for healthcare facilities. So Kerala lies, I have pasted one map for all of you. Kerala lies in this part of southern part of India, students. So now let's talk of Kerala experience. So in 1996, the Kerala government made some very major changes in the state. 40% of the entire state budget was given to panchayats. Now panchayat means all those people who are dealing in village level. What will they do with that money? Think. They could plan and provide for their requirements. This made it possible even for a village people, rural area, to make sure that proper planning was done for proper and clean water, food, women's development and education. This meant that water supply schemes were checked, working of government schools and Anganwadis were also kept checked and specified problems were taken to the concerned departments. So everything was done with a good amount of planning. And how it became possible? Because Kerala की government ने 40% of the budget village की पंचायत को दे दिया. I am giving you this amount of money. I am giving you this responsibility, additional responsibility. Now it's your sole purpose to take care of it. So in this manner, these methods were applied and Kerala was the number one in healthcare system apart from literacy. So this initiative was made to change by the Kerala government. Now, another we will be discussing about country which is not there in India but it is there somewhere near Costa Rica. Now Costa Rica is another country which is very well known for healthcare in Central America, entire Central America. Q. It is also famous for beaches and it lies somewhere near the Central America. Now why are we studying about Costa Rica? Has it done something like Kerala? Think. कुछ तो किया होगा ना. So Costa Rica also followed another type of approach that was known as Costa Rican approach. Now under this approach, in order to evolve, improve and facilitate better healthcare facilities, it is considered as one of the richest countries in Central America. A country is very small but it is considered as the healthiest. Why? Because this can be found in the Constitution of Costa Rica. So what it did, many years ago, it took a very important decision and decided not to have an army. No army, no war, no money spent on, army people, making them learn and their exercises and their quarters, everything, subsidies. No army, no extra wastage of money. Instead, what it did, it helped the Costa Rica government to spend money. जो आर्मी में पैसा लगाना था, it spent all this money on health, education and other basic needs of the people of that country. Fooding, clothing, women's empowerment, education, development, and all those things. And in this manner, it became healthy because it was developing because of good amount of facilities and it pays a lot of attention to the health of its people. That is why it is known as the healthiest of North America and Central America. Now this country, the Costa Rica government provides so many services and amenities to all the people of its country. For example, it provides safe drinking water, better bathroom and sanitation facilities, nutrition, housing, and health education. So this, by adopting and approaching this approach, by having this positive outlook and mindset towards life, towards the health and betterment of its own country, this country indeed took a very huge step and it surpassed all other countries in terms of health. So this was Costa Rica. Now, now you need to think and tell me. अभी तक हमने discuss किया so much about health services, about services in India, specifically how Kerala is doing well in healthcare. What about Costa Rica? How it is adopting strategies. So by now things are clear to all of you. So you need to tell me elaboratively how improvement in water and sanitation can control many diseases. You need to tell me with the help of appropriate examples. Fine. Now, the Kerala government made some major changes in its country. In which year? In 1996 onwards. So up until here, things are clear to all of you. So students, so today we have discussed about what is who, what is health, what will happen if we'll have healthy food, what will happen if we'll have junk food, what is the healthcare condition of India with respect to private sector, with respect to government or private sector, individual sector. And then we have also studied about two important approaches, that how those approaches are adopted by Kerala government of India, state of India, and Costa Rica, that is another most important country of Central America, in improving the health standards of its people and developing people in its various platforms. So you need to tell, think and write all these on your notebooks. What are the different ways through which government can take steps and provide healthcare facilities? And just now we have discussed so many things. So from your sector, think which sector of healthcare providers provide better facilities. Is it the government or is it the private which is owned by individuals? You need to think and discuss it. And there is one homework for all of you students. Observe this chart which is given below and then mention the healthcare issues and also mention what are these issues and suggestions how we can take care of these issues and how your country is tackling with state is tackling with these issues with respect to health and betterment of the people. So today we have discussed about role of who, private healthcare, public healthcare, and two different approaches. In the other coming classes and videos, I'll make a video on how we can improve the health standards of a country. If you have any doubt, feel free to comment on the chat box. Till then, take care, goodbye. Keep sharing, liking and subscribing my channel and videos for better videos. Thank you students.